Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. And you can also visit my playlist. In the playlist, I have provided almost all the topics in a very systematic order. You can make use of it. So, anyway, we will continue with our topic analysis of the doshas. So, dosha prakriti, etc., we have seen in the last class. So, today we will discuss about dosha lakshanas. Now, what do you mean by dosha lakshanas? Now, Bhanumati Tika very clearly explains. Dosha lakshana can be identified by two ways. One is swabhava rupa and another one is karya rupa. So, these are the two things how you can identify the dosha lakshanas. One is by the swabhava rupa and another one is by the karya rupa. Now, what do you mean by swabhava rupa? Swabhava rupa means doshas are not visible by the swabhava. Okay, doshas are actually not visible. Now, why they are not visible? It is their swabhava. Okay, that means doshas are actually not visible, but by their swabhava itself they can be identified. This is the meaning. Okay, swabhava rupa. That means itself doshas are not visible structurally, but by looking at the swabhavas of that doshas, you can identify it. For example, ruksha, etc. gunas of the doshas are not seen actually, but it can be appreciated. So now it is by the swabhava of the doshas. When you have got dry skin, you can appreciate, yes, there is a vata doshas, but as itself, that vata guna and inside that vata guna, that ruksha guna cannot be seen. But you can appreciate, yes, the ruksha guna of the vata has been increased. Okay, now this is called as swabhava rupa. This is called as swabhava rupa. Only by the swabhava of that particular doshas you can identify the doshas. Another is karya rupa. Okay. So karya rupa means vatadi karma karya gamya eva. That means vatadi karma karya gamya eva. That means like vata increases the lagu guna in the body. So when you have got a feeling of lightness in the body, you can say that or you can assume that yes, the vata is increased. Okay. So now it is karya rupa. The first one is swabhava rupa. Second one is karya rupa. Again, the question arises, why the doshas are explained first? Why not the dhatus and malas? In the context of this dosha, dhatu and mala, doshas are explained first, isn't it? Why not dhatus and malas are explained first? Let the doshas explain at the end. No, it is not like that. The reason is, doshas are the one which actually cause the dhatu vruddhi and kshaya. Vikara kartatvat. Okay, so doshas will going to cause the dhatu vruddhi and as well as dhatu kshaya. Therefore, doshas are explained in the beginning. It is just like the seed of the mango which leads to the mango tree. Okay, from the doshas itself, these dhatus and malas are formed actually. So therefore, doshas are explained first, and these doshas can be identified by two important things. One is by their swabhava, and another one is there by karya. I have also given the example. So next we come to the another important aspect of the dosha. So that's called dosha types. Now, dosha types. How many types of the doshas are there? Now, types of the doshas may be confusing, isn't it? So, dosha karya can be identified by normal and abnormal functions. Okay, so dosha karyas can be identified by the normal and abnormal functions. But Hemadri, the Tikakara of Ashtanga Hridaya, so he says, Hemadri explains how to identify the doshas as for the clinical or treatment purpose. For the purpose of the treatment or clinically, what are the different types of the doshas that you need to identify? Number one is Agni Avastha Vishesha. Okay, so doshas can be considered as Mrudu, Tishna or Manda, etc. depending upon the Agni Avastha Vishesha. This is one type. Second one is Koshta Avastha Vishesha. Doshas can be causing Mrudu Koshta, Krura Koshta or Madhyama Koshta. Again, this is Krura Avastha, that is Koshta Avastha Vishesha. Similarly, Deha Janma Vishesha. Okay, doshas can be also accordingly Deha Janma Vishesha, like Shukra Artava Janmado. And last one is Prakriti Visheshatvat. So these are the four types of the doshas appreciation which is explained by the Hemadri, which is quite useful for the clinical purpose. Agni Avastha, Okay, so patient is not having appetite, Manda Agni, so I definitely say the kapha is increased, or kapha increasing factors are more in the body. More appetite is, I will say that pitta is increased. So now this is Agni Avastha Vishesha. Similarly, Koshta, similarly for the Deha Janma Vishesha, and also Prakriti Vishesha. Now, another important aspect which is related to the dosha is dosha mana, that is dosha quantity. A lot of things have been told about this dosha mana. Quantity of the doshas. Now, actually, in the classics, the dosha mana is not explained. Dosha mana is not explained. Each body is different as for Ayurveda. Why dosha mana is not explained? Each body is different as for Ayurveda. Purusham Viksha, it is told that the amount of the vata dosha which is present in my body may not be there in the same amount in your body. Similarly with the pitta and kapha. So therefore, giving exact the mana of the dosha is quite difficult. It depends upon your ahara vihara etc. So you cannot say blood is 5 to 6 liters in the body. So this is possible in the contemporary science, but it is not possible in Ayurveda. Okay. Similarly, the vata doshas. For example, in children, Kashyapa very clearly says in the body of the child, the vata doshas are not completely formed. Therefore, the treatment and management of the children is very difficult. Vatadir binaha. Okay. So chesta ingita darshanai. So therefore, dosha mana is not explained because each body is different, and within each body the amount of the dosha is also different. It is not an equal one or average one. Another one is this is one thing why dosha mana is not explained. Another one is Vailakshanya Sharira. Therefore, for example, a child with a person with Hrisva Sharira, Dirgha Sharira, or Sama Sharira, okay, will have different amount of the doshas. It's not equal. It's not equal. Vailakshanya Sharira. Another one is Asthai Bhava Eva. Asthai Bhava Eva. Daily undergoing growth and destruction. Because we believe in Kshanabhanguravada. Each and every part of the body is undergoing destruction and reconstruction in each and every second. Okay. So exactly mentioning this much of dosha is there in the body is quite impossible. So Asthai Bhava Eva. Asthai Bhava Eva. And lastly, Nitya Kshaya Dosha Vriddhi. Daily there is going on Nitya Kshaya and Vriddhi. Seasonally there is going on, and Rutu-wise is going on, diurnally it is going on, and each and every moment it is going on. So therefore, identification and putting the dosha mana in a figures, in exact figure, it was impossible. So therefore, they says dosha mana is not mentioned. Very clear explanation. Okay, so in the Kaumar Bhrutya also, as I told earlier, the children, they were told that it's very difficult to treat the children because vata, the doshas are not completely formed in their body because they are immature. Next we come to the samatva of the doshas, which we will discuss in the next class. Thank you very much.